Hello, welcome to the channel of Psychiatrist would tell. Many people may wonder, when there is a problem of stress or distress, consultation with a mental health professional might be a good solution. But sometimes we may be confused about who to see, a psychiatrist or a psychologist. Today's psychiatrist will tell you about it. Regarding the difference between a psychiatrist and a psychologist. First, who are psychiatrists and psychologists? It is a question that many people wonder because the two professions are very similar. Psychiatrists are those who graduated from the Faculty of Medicine and continued their specialized studies in psychiatry. A doctor who specializes in treating people with mental illnesses. As for the psychologist, those who graduated from the Faculty of Psychology, Faculty of Humanities or Faculty of Social Sciences in clinical psychology courses, study human behavior, mind, thought system, and social environment, and is a clinical psychologist. Second, what are the duties at work? Psychiatrists are responsible for diagnosing and treating psychiatric diseases. Psychologists are responsible for evaluating psychological and behavioral problems. Third, can both prescribe medicine. Psychiatrists can prescribe medicine, but psychologists cannot prescribe medicine. Fourth, can both provide counseling and psychotherapy. Psychiatrists and psychologists can provide counseling and psychotherapy. Fifth, what is the method used for work? Psychiatrists often use drugs as a way to treat disease, to adjust chemical levels in the patient's brain. Psychologists often use talking, counseling, and psychotherapy to adjust the behavior, thoughts, and emotions of patients, and can do psychological tests to make a diagnosis. Sixth, both are suitable for which group of patients? Psychiatrists are suitable for people who have abnormalities in the body or brain, unable to control himself or sleep normally. The symptoms are severe and complex. Medicine must be used for treatment as well. Psychologists are suitable for people with psychological disorders or have behavior and thoughts that affect daily life, whether it's work, family, or relationships, or have a feeling of insecurity about yourself. Will use the method of talking psychotherapy to adjust those thinking behaviors without using medicine for treatment. Seventh, is it better to see a psychiatrist or a psychologist? It's a question that probably won't have an answer, because of each is an expert in their own field. No one has more or less expertise, and in some cases, seeing both a psychiatrist and a psychologist might get better results. Although there are differences between psychiatrists and psychologists, but for the most part, both must always work together as a team, which if any line of work is missing, maintenance may not be as efficient as it should be. Therefore, both psychiatrists and psychologists are important in taking care of your mental health without any difference. Today on the channel Psychiatrist would tell, I'm going to say goodbye for now. Don't forget to like, share, and subscribe. See you again. Goodbye.